Croeso, good evening and welcome to the next series of the talks that were supposed to be around menopause. If you are watching and you want to join in the conversation, please feel free to make a comment, but do be aware that they are on the internet. If you want to message me afterwards, that's fine. We are starting at 7:30, but I've always come on early because Facebook is always a bit twitchy. So if you're watching this live on YouTube, just skip past this first 5 minutes until we get to the introduction. You know, it's not as if we're doing a podcast with an editing suite, and it's just me in my bedroom. But here we go. All right, so as you know, October is Menopause Awareness Month, and it's Menopause Awareness Day on the 18th. I'm going to be giving a talk on lifestyle on that day, and I was going to be doing an in-person event on that day. Hello, Eleni. But I've moved it to the 25th. So if you want to have an in-person day with me, I'm going to do like kind of come and meet me kind of thing. So we're meeting in Capelgossan on the 25th. I'm going to teach disco simply because it's just the best way to improve your bone health, your stability, your coordination. We're going to have a talk on menopause, and then we're going to do a weight session to understand how we load the bone specifically for bone mass. And there are opportunities to have prizes. So if you're there on the day, you can buy a raffle ticket, you can have free passes to classes. There is going to be one free pass to the wellness retreat in Cardiff. Okay, so it's called the Seasons of Change, and it's based around how menopause changes our health and the things that we can do about it, as well as a t-shirt and a bag and all of that. All right, good evening, good evening, good evening, still on the floor. Okay, so it is now 7:30, so I'm going to get started on the talk. And this is a talk I've probably given more than the others because it was the one talk that really shocked me when I was going through my menopause. And I hope that it resonates with you because I think osteoporosis is something that we don't know we have. And I think I did a post the other day saying, can you tell how fit somebody is simply by looking at them? So externally, you might look fit and healthy, but you cannot tell the density of your bones. Now, as somebody who teaches back care Pilates, I quite often get a lot of people coming to Pilates classes with bone pain that may or may not be related to osteoporosis. My mother's currently living with us and she has horrific pain with osteoporosis. It's heartbreaking to see somebody. And in a recent scan, they said her bones were like glass. And I mean, we don't want that for females. So let's have a look at why are females most at risk. Hello, hello, hello. And what we can do about it. So if I say anything of any interest, don't forget to post it up or ask a question and I'll come back to it. So what kind of things we're going to do is to look at bone density and how it changes with both age and menopause. And the reason that I've separated this out is due to the fact that some women will go through a menopause much earlier. So for example, you might have endometritis and you might have a hysterectomy where they remove the womb, and even though the ovaries are there, they never work the same. So you are longer without estrogen, or you might have had breast cancer, or you might have had bowel cancer and had chemotherapy or radiotherapy that has then destroyed the ovaries. So time and age of menopause are often important. You might have a familial kind of genetic disposition to an early menopause, and so that is important as well. As we all age, regardless of our menopausal journey, we have this increased risk of fragility within the bones. And I think I've famously said I'm going to get a t-shirt that says fragility is not our future, because I was so scared when I first had my operation, have both ovaries removed, to know that my bone density was going to be compromised. Yes, I can look back on a lifetime of jumping up and down, but I was never really a gym bunny. Okay, I'm a power. I'm a group tutor through and through, aerobic, step, all of that. So bone density refers to the amount of mineral that is held within the bone. It measures how strong and how solid your bone is. The higher your bone density, the less likely they are to break. So, bone is a living tissue. It is constantly broken down and rebuilt through a process called bone modelling. So you might quite often see BMD, bone modelling density. And it is this circulatory process that what influences the propensity that we have to have osteoporosis or not. Our peak bone density happens within our 20s and 30s. So sometimes we don't know we have weak bones until we break something. And by that time, people can think like it's too late. So we're going to have a look at, what can we do about it and how do we prevent a break? And we talked about this last week about whether the risk of it happening as well as, do you fall? And from midlife onwards, so if we're thinking midlife, maybe 40 onwards, especially after menopause, that's over 50, we have this natural decline in bone density. And the only way to measure it is what's called a DEXA scan. So a DEXA scan, a dual energy X-ray absorptiometry, measures bone mineral density, BMD. It uses kind of a very low dose of X-ray to see how dense and strong your bones are. And then they give you a score, okay? So it's called a T-score, and it helps to diagnose whether you are osteopenic, at risk of osteoporosis, or osteoporotic. Now, this scale diminishes, all right? So the scale doesn't stay the same. The scale is dependent upon your age. I have women in my Pilates classes who have reversed osteopenia through exercise and diet. And these are people who have been told you were at risk, now you no longer are. Sometimes it's to do with the differentiation in score, sometimes it's to do with increasing bone density. But these kind of things are really interesting. I'm also on a group on Facebook where people are horrified at their scores and also horrified at the kind of outcome that medical profession are telling them. And what I would say is this. Today you might not know you have weak bones. If you find out tomorrow you've got weak bones, that changes your mental attitude to how you move and how you walk. And that kind of thing where we want to protect our body has to be flipped on its head, because we protect it by making it a strong armour around it. If you've ever had a T-score, it compares bone density to that of the 20 to 30-year-old at peak bone mass. And it says but how does it compare to a young person? So if it's 0, it's the same as a young person, well done you. If it's above 1, it's considered normal. If it's between -1 and -2.5, this is where we see this gradual loss of bone mass, so lower than normal bone density. And if it's below 2.5, it means you have osteoporosis, which is significantly low bone density. The lower the score, the higher the risk of fracture. Now, the most common fracture sites are wrist, shoulder, and spine. Hip is also there, but usually the wrist and shoulder happens when we put our hand down and we break the fall. We often break our hand or break our wrist or break our shoulder. The spinal fractures tend to be what's called a fragility fracture, where they break spontaneously. So I talked earlier about whether you notice you've shrunk a little bit, whether you've got chronic back pain, and the kind of things I hear people say, like, yeah, I did something, I hurt my back and it took 6 to 8 weeks to get better. Already for me, my red flag's going up, going like, that's how long it takes for a bone to heal. So there are drugs you can take, and I'm not a medical person, so I'm not going to talk to you about the drugs. You need to go and see a GP about this. I'm going to talk to you about the role of exercise and the way that your hormones influence this, because my My background is around hormonal health, around how our hormone profile influences both our physical and mental health, and what we can do in a practical way. I'm a very practical person. I'm not one known to be crying or anything like that. I kind of just get on with the job. So let's have a look at some of the factors that influence bone loss. So we talked about hormonal changes, and one of the hormones that we want to talk about is, of course, estrogen, because estrogen protects our bone strength. And during the menopause, as our estrogen levels drop, it speeds up this kind of turnover of bone. The turnover of bone is due to the different cells within the bone. So I'm going to touch on this briefly. It can be complex, so bear with me. So you have an osteoclast, which is a cleaner of dead tissue. All right. So I always think of it, okay, I have a simple mind. I always think of it like a Pac-Man eating the dots. So he eats up all the dead and old bone. You know, like you shed your skin and then you got new skin underneath. So you shed your old bone. So the osteoclasts clean up any dead or old bone, and the osteoblasts build new bone. When you have no ovaries, like I do, apparently there is minimal, if any, bone building activity via estrogen signaling because there is no estrogen circulating. Now, we've talked about this before. If you're on the coil, or maybe you're on the pill, or maybe you've had a baby late in life, or you haven't had an early menopause, you are more likely to have better bone density than somebody else. One of the scary things that I read was about having children. And when I first read this, I couldn't work out why childbirth was a risk factor for osteoporosis or not. And what they're saying is that when you are making a baby inside your body, you have like this super load of estrogen and progesterone and testosterone that densifies your bones, and you are much stronger the more children you've had. And I think this might be in part some of the ways that, you know, people said like, oh yeah, people years ago, they never used to have all these illnesses. Well, you know, maybe they had 15 children, you know, you never know, they could have had other issues, or maybe they died in childbirth. So having children, and having children later in life or throughout your life, or having more than 2 children, kind of gives you this boost. Being on the pill, being on the coil, all of these things help. But sometimes this doesn't happen, and other lifestyle factors interfere with estrogen. So we're going to talk in particular today about smoking, and we're going to talk about obesity, but also we're going to talk about the natural aging process. So as we age, whether we're male or female or any other colour of the rainbow, our bone modelling, BMD, becomes less efficient. Okay, like anything else. You've got saggy skin on your face, you've probably got saggy bits on the inside, including your bone. The osteoblasts still build bone, but it's slower, okay? And you then also have a loss of muscle mass. So when we start to lose muscle, muscle plays a key role in stimulating the bone to grow through another hormone called growth hormone factor, human growth hormone. I can't even speak tonight, can I? Bear with me. We stress the bone out and it becomes stronger. Also, as we get older, we tend to be less active. I think a lot of this is to do with society, and a lot of it's to do with the fact that we actually get a bit slower. So when we lose bone, when we lose muscle mass, you know, chores become a little bit harder, life becomes a little bit more difficult, we walk a bit slower and become a little bit less inactive. The longer we sit and rest, the weaker our bones get. And this is particularly true that if you have found out you're osteopenic, and therefore you take to your bed to protect your bones, it actually is detrimental. So the loss of impact, You know, when you're younger, if you watch somebody who's 5 or 6, they run and they jump and they skip, you don't see us adults doing that, which is why I always say disco is a great way to build bone mass, because you do actually skip in disco. Anyway, so these different factors are something that you have to play about with. And what we want to do is we want to have that in our mind to check about any imbalance. When we come to menopause, all right, so remember, menopause is defined by a year and a day without a period, all right? So if you are perimenopausal, what you might find is that your periods are starting to change. You might have periods close together, you might have continuous bleeding, you might have a period of 3 months and then a very heavy period. It is when you have been 1 year and 1 day that they say you are in menopause. And certainly, you know, I notice this kind of change in me. What happens is, in the first 5 years after menopause, we have a rapid loss of bone mass. So around 10% of bone mass is lost within the first 5 years after menopause. And after that, the average bone loss rate is around 1 to 2% per year. The most rapid bone loss is within the spine and the hips. Okay, and this significant decline is mainly due to estrogen and early bone loss. So if you have had menopause at the age of 35, the longer you are without estrogen, the more bone mass that you're going to have. So you're still only losing 1 or 2% a year, but maybe you'll have that for 10 years longer than somebody else. So the Royal Osteoporosis Society has a lot of really interesting information about why we see this rapid bone loss and also what to do about it. So I highly recommend going to that page. They've done a kind of big study, and what they say is broken bones break lives. This is their statement. And that UK's fourth biggest disability and early death is related to osteoporosis. And it's not so much breaking the bone, it is being inactive either after the bone because we're scared. And we know that half the women over the age of 50 will break a bone due to osteoporosis. So if you're somebody who has broken a bone, go and get the check, okay? Because you really need to kind of have a little think about whether, you know, you're at risk so that you can start to implement some things. So we also have genetics, lifestyle and medication. So let's have a quick look at this. So in genetics, you might have a family history of osteoporosis or hip fractures, or you might have a smaller frame, okay, so smaller bones, or a naturally low bone mass. So we know that people from Asia tend to have this kind of issue, as well as white people, to be honest. Your lifestyle, whether you do lack of weight bearing or resistance exercise, you don't do anything that's bone loading, whether you smoke or you have excess alcohol, because both of those interfere with estrogen, which then interferes with bone mass. Whether you have had an eating disorder as a young child, so you've reduced the amount of minerals to build your bones. Remember, you have peak bone and then you lose it gradually. So if you had an eating disorder when you were younger, or you were a serial dieter, or you had very low body weight, then you can see this kind of issue. But more recently, there's some kind of research around obesity and bone mass. And I find this really fascinating because, to me, if you're bone loaded, because you're heavier, you would protect your bone mass. And many years it was believed that a heavier weight protected the body against bone loss and fracture. So the kind of logic behind it was we had increased mechanical loading on the skeleton that stimulated bone formation. And maybe we had higher estrogen levels because quite often fat can sometimes hold estrogen in it. However, more recent and detailed studies show that this is really an oversimplification. And whilst bone mass density can be higher in people with obesity, the bone quality is often poorer. So that means the bones may appear denser on the scan, but are more fragile and prone to certain fractures, especially in ankle, upper arm, and in the spinal vertebrae. And what happens is this is a kind of a complex kind of thing. So we have something called a cytokine. Okay, so cytokines are small proteins that are chemical messengers between cells. Okay, so think of them like the postman delivering messages. They're mainly produced in the immune system, but also in fat and muscle and bone cells, and they help cells communicate during immune responses, inflammation, tissue repair, and they either promote or reduce inflammation depending on the situation. In the context of obesity and bone health, excess body fat, in particular around the belly, produces more cytokines that increase inflammation. And this disturbs the balances between the bone building cells, osteoblasts, and the bone breakdown ones, osteoclasts. I found this really fascinating. So what they found in particular was that these cytokines, these chemical messengers, promote something called osteoclastgenesis, bone breakdown. So they speed up the cleaning and they slow down the building, which means that you get an increase of bone turnover. So we kind of lose the internal structure. There are many ways that it goes about. It's sometimes to do with the marrow fat, it's sometimes to do with insulin resistance, where we talked, if you were in the cafe, we talked about diabetes, and sometimes it's to do with menopause, because the picture is more complex there, because we see this increase in belly fat, which then produces more of these inflammation kind of chemical messengers, which then influences our bone quality. So what they think is that these lead to what's called osteosarcopenic obesity, where muscle, bone, and metabolic health are declining even though the person is heavy. They're heavy with fat and not with bone mass and muscle. You know, it's really interesting. It's about the small microarchitecture of the bone. So I found that really fascinating. Anyway, so some of the primary risk factors are due to being female because of estrogen, and women are at greater risk of osteoporosis the longer that they are without estrogen. Then on top of that is your age. Okay, so we talked about, you know, 1 in 2 approximately, you know, 1 in 2 people at the age of 50 will break a bone. 50% of all 80-year-olds will have some kind of osteoporosis. Okay, so you can break a bone at osteopenic. We also know that a slight build is another one, but I would then add in being obese. So there's some medications that we talked about, and these are often to do with different kind of things. So for example, you might have rheumatoid arthritis, or you might have naturally low estrogen. Maybe you had anorexia, maybe you had a hysterectomy before the age of 45, maybe you have had hyperthyroidism. Okay, so your thyroid is overturning so much, or you have parathyroid disease, or you have conditions that affect the absorption of food, such as Crohn's disease or celiac, or conditions that cause poor mobility, such as a stroke or Parkinson's disease. The other one that they found is that people who take drugs for asthma tend to have lower bone mass, because the cortisol within that causes an influence on bone health. So when we now talk about breaking a bone, I mentioned something called a fragility fracture. And a fragility fracture, when a bone happens from a low level impact that wouldn't normally cause a fracture. So for example, you might slip, you might fall, you might sneeze, or sometimes it really is spontaneous, where you wake up one night with back pain and you think, oh, that doesn't feel quite right. So spinal fragility fractures are the most common site for fragility fractures, and is often called a vertebral compression fracture. And this is where the vertebra collapses in on itself. So a bit like, it comes down a little bit, like your sponge that's not cooked. And this could be due to your body weight or even just slight movements. They often happen without any obvious injury, and sometimes people don't notice any immediate pain, but they might have gone to be measured and they've shrunk. They might have had this more rounded position, or they might have had a more kind of problems with digestion and lung issues. Now, I've talked about this before. Can you see me? I don't know if you can see me. I've got my pajamas on, can you tell? So this part, when we have a kyphotic posture, if you feel your rib cage here, what happens when you have this, the ribs come in like that, okay? So instead of them being upright, they come in this way. So number one, it reduces your lung capacity. So again, this makes kind of walking or doing any kind of exercise, you can't take a full breath, but also it presses onto your stomach. So you get a lot of acid reflux, you get, kind of GERD or things like this. And that influences us. So it's like a knock-on effect, if you want to think about it like that. Remember, if I'm saying anything you think, oh, that's quite interesting, don't forget to put it in there, because it's really fascinating when I hear other people talk about it. So the impact of spinal fractures or a fragility fracture is a cycle. So if you've had one fracture of your spine, the likelihood is you'll have another one within a year. And the more spinal fractures you have, the more likely you're to have a hip fracture. And hip fractures have a more serious kind of issue. So let's look at prevention awareness for my last 4 minutes. Because we want to protect our bodies as well as our mental health. And remember, nearly half the women who have osteoporosis will have some kind of depression, reduced sense of well-being, reduced quality of life. And it's what can we do? So we want to think about prevention and protection, and one of the best things we can do is exercise. So why does this matter? Well, regular weight-bearing resistance exercise slows down bone loss and can help build bone if it is of the right intensity. So it might mean you might have to start easy, but you don't be complacent. Now, I've talked about being a weekend warrior, and this was all to do with cholesterol, but having a look at bone mass, the more you can do that, I always think it's like a hammer and nail. The more times you can hit that nail, the better it is. We want to look at muscle strength, but also balance, coordination to reduce the risk of fall. We know that weight bearing works, okay? We know that resistance works, whether that's using your body weight, whether that's using free weights, whether that's using bands. We also know things like Pilates and Tai Chi really make a difference to you not falling over, because you can have a fragile bone, okay? And as long as you don't fall over and break your hip, you could be okay. And we want to maintain good core strength and flexibility. Resistance training for bone mass is really interesting, because not only does it apply that mechanical stress to the bone, it also increases bone deposits within that bone. So weight-bearing exercises has been shown to increase bone mass density significantly in postmenopausal women. You are never too old, and it is never too late. We also get this change in what we call that microarchitecture. So resistance training not only increases bone mass, but enhances the quality of the bone microarchitecture. So when we talk about people who are obese, and sometimes if you're obese, you're not going to do jumping up and down and doing high rocks, because it's going to be impossible. But you can sit in a machine and lift weights. Resistance training also boosts the production of what's called growth hormone, which is an insulin-like growth factor, which plays a critical role in bone modelling and maintenance. And finally, improving muscle strength and coordination. Resistance training increases load bearing capacity on the bones. Okay, because as well as training the bone, you're training the tendon and the ligament that support the joint to allow you to work harder. Don't worry if you've never done the gym before, okay? But cardiovascular training is also crucial. It increases what's called the mechanical load on the bones. So we talk about disco again. When you're doing run to the side, you are increasing mechanical load on the bone. But also you increase what's called circulatory efficiency. So you have more blood vessels that deliver nutrients and oxygen to the bone. We started by saying the bones are real living tissue. You have to feed them. When we do cardiovascular training, we train our motor skills, okay? So we become more balanced and it helps us want to do more. But cardiovascular exercise also boosts the release of growth hormone and other anabolic hormones, which contribute to bone formation and preservation of bone mass in postmenopausal women. Most importantly, cardiovascular training reduces inflammation. So those cytokines, okay? So regular cardiovascular exercise decreases chronic inflammation, which can interfere with bone modeling and lead to bone loss, thereby promoting a better bone turnover. So you want to aim for a mix of exercise 2 to 3 times a week. Focus on good technique, posture, work to the best of your ability. Don't just go there and just kind of faff about. Work hard, focus. Start gradually, especially if you've got osteopenia or osteoporosis, and get advice if you have a history of fractures or you've got one of the medical conditions that I've talked about. Calcium and vitamin D and protein and magnesium and vitamin K2 are where you need to be. Whilst you can get these from whole foods like dairy, leafy greens, oily fish, nuts, seeds, eggs, or fortified foods, so you might see them on the label saying fortified with, you may need additional vitamin D, especially in the winter, and get professional advice if you're not quite sure. You need to have around 1,000 micromilligrams of calcium per day, okay, plus vitamin D. Think about putting protein every meal time. Think about more calcium in across the meals, okay? And you don't have to drink milk, okay? So there's lots of controversy about milk. Think about getting calcium from the other things that we talked about. And then finally, at the end of this, remember that bone health is dynamic and you can take steps from today to slow bone mass down and build strength. Know your risk, know your family history, your lifestyle, what medication you're on, whether you've had operations. Eat well for your bones, calcium, vitamin D, protein, magnesium, vitamin K2. Stay active, weight bearing, resistance training, cardiovascular work, balance work. Check your bone health if you're worried. And every small change adds up to a big difference, so that fragility is not your future, that you are in charge of this. It has been an obsession of mine. If you're in the cafe, for those of you in the cafe, I used to teach body fit once a week on a Thursday, so I do weights once a week on a Thursday. And I now do 20 minutes on Monday. Okay, so we do 20 minutes of Metabolic Monday, usually with weights, and then we do a dumbbell session in the evening. Then we do a barbell session on Tuesday morning, then we do a kettlebell session on Wednesday morning, and then we do a weight session on Friday morning. And that kind of more active, spread out resistance training works really well. I hope you found this talk of interest. If you are interested in more in-depth information, don't forget the retreat days are great. I've got 6 spaces left on Cardiff. One of those places are going to be free in the Menopause Day. If you want to come to the Menopause Day, it's in Capelgossam from 10:30 in the morning till 1. You can do part of the day, you can do all the day. It's £5 to join in. You can stay for as long as you like. You have tea and coffee and a chance to win anything. I don't really want to promote it like that, but I just feel like people say to me, Rachel, can't you do something in person? So I'm doing it in person, so don't let me be there by myself, okay? Because online, you know, the last video I think got 5,000 views. So online gets to a bigger audience. But if you want to meet me in person, see you on the 25th. Otherwise, I'm going to talk to you about lifestyle medicine on Saturday morning, which is International Pilates Day. We'll also be launching the level 3 menopause course. I'm sorry that's taken so long, but if you are a fitness instructor, I will be delivering a level 3 menopause course via the YMCA from Saturday the 18th, which I think is quite appropriate that we launch it on International Menopause Day, and you can start training from the Monday morning. Take care, everybody. Have a nice day. I'll see you all soon.